Hi. This is Dr. Subhas Pradhan. I'm a psychiatrist, and I have got a letter from your GP, your family doctor, and I know something about your case. So, would you mind telling me about why did you come here today?
Well, in the first place, I did not want to come here,
Mm-hmm.
but then my wife said I will not lose anything by seeing you.
I see.
So I decided to give it a go, and I came
Mm-hmm.
here. It's just basically I don't know why. See, I'm a banker. A few months back, I lost my job. The banking sector is struggling nowadays. So since then, I have nothing much to do, nothing to look forward to. I have applied for a few
Mm-hmm.
jobs, but unfortunately, there are not too many opportunities available at my level.
I see.
And sometimes, just even if I'm interested, the bank would say that I'm overqualified, over experienced, and so
Mm-hmm.
it's a kind of like yeah, very dark and grim situation.
Mm-hmm. So, I understand the situation is quite terrible. Lots of people have lost their job, bad times. But tell me, how that has affected your personal life? In which way?
Well, if I could explain, it's from the sky right to the earth, or from the sky to the fry pan,
Almost
and day by
everything.
day it is changing from fry pan to the fire.
Mm-hmm.
And I used to make a good amount of money, and
Mm-hmm.
you know, you establish a certain kind of lifestyle, you try to maintain, and it's very difficult to
Okay.
compromise at a lower level. And so, yeah, no, I don't go out. I try to avoid meeting my friends, and so
Mm-hmm.
yeah,
So lots
I
of
spend most of the time in my room.
Mm-hmm. So I understand you look quite depressed, quite sad. Um, I'll ask you a few questions just to qualify so that I'll be in a better position to give my opinion on that. So, uh, about your mood, in a scale, for example, as you said depressed, I'm just trying to measure it from 0 to 10. 0 means feeling lowest, 10 means feeling normal. Where would you put yourself last maybe couple of days, couple of weeks?
Well, I know where 10, what is 10,
Mm.
but as far as the lower side of the scale is concerned, I've never felt like this ever in my life.
Mm. Mm. Too
I've
bad.
always been a
Too
high
bad.
flyer, and all of a
Yeah.
sudden it seems like my world is falling apart.
Mm. Mm. Yeah, people upon when they go through this phase, they also have some other issues like they lose appetite and some people have lost weight.
Yeah.
And what about you?
See, nowadays I'm surviving on just coffee, tea, and smoke.
Okay.
Uh,
Mm.
I don't feel hungry.
Mm.
Maybe because I'm not doing much, I don't go out much, so I'm
Mm.
not burning enough calories, and yeah. But yes, I kind of finding my clothes being a bit loose on
Is
me.
it?
Yeah.
Okay.
Although, like, if I look at myself in the mirror, I do not see any obvious
Okay.
weight loss.
Mm.
And yeah, sleep, it's not the best either.
Mm.
It takes me ages to fall asleep.
So going to sleep is a problem.
It's a
But
problem.
getting up, some people get up a bit early. Do you think that's an
No,
issue
yes,
with you?
basically that is not a problem at all, because
Okay.
I'm getting up very early in the morning, and doesn't matter how hard I try to go back to sleep, I just can't.
Okay, so maybe 1 or 2 hours before your usual time, think?
Yes, easily,
Okay.
maybe slightly more.
Mm.
So
Mm.
yeah, I feel tired, exhausted all the time.
Mm.
I
Mm.
have no interest in anything.
Okay. Um, just in that line, when you're talking about smoking, drinking tea, some people also use to take drug alcohol when they feel low. Do you have any issues with that?
No, just see, I've always been a social drinker, and now because I'm not socializing, so this is not something
Don't.
that will come to my mind. And
That's not
secondly,
a
my
big
problem,
issue.
yeah, and the other thing is my problem lies somewhere else, and I know
Yes.
it's not going to help me.
Mm. And don't mind me asking this personal question, but when you told about lack of interest, what about your interest in, say, the physical side of things, the sexual side of life?
Doctor, that would be the last thing on my mind. No.
Okay.
Basically, like even when my family members, they try to call me, I would just have a look at the phone and I'll just let it ring, but I will not
Sure.
take the call.
Must be very hard. Yeah. You mentioned about feeling low. I mean, another time, visible as well. Have you ever felt so low that you thought maybe it's not worth living anymore?
Well, see, I would if I could, but I have children as well, and being a Muslim, I do not see it as an option.
Okay, so not any like sort of. So thanks for letting me know, because that was very important issue to clarify this point. Other thing I wanted to clarify about. I understand you are a banker. You had a responsible job in the past. You had to have a lot of concentration. What about now? Are you able to focus on things or any?
No, I have nothing to focus on.
Yeah.
But no, actually, just for hours I'd be just staring at the TV. And but if you ask me what I've been watching, I might be able to tell you, few things. But if you ask me the details, I would have no clue.
Okay.
I feel like my mind is numb. I cannot laugh freely. I cannot cry freely.
Okay.
So I don't know how to describe it, but it's not a good feeling.
Absolutely. And so I just wanted to point out when I was mentioning about these things, the duration. You said a couple of months ago that thing happened, like a job problem. So
Yeah,
how long
yeah.
have you been feeling this bad?
The thing is that no, actually, just the job thing happened almost 6 months back,
I see.
But then the first 2-3 months I was trying here and there, but no, I think this dark cloud has completely overtaken my vision, at least for the last 6 weeks, 7 weeks.
Okay, so that's been quite bad.
Yeah.
Time. I want to clarify some other questions I want to ask so that I'll be in a better position to make my own judgment. What about people those who feel low? Sometimes they feel opposite, like so happy on the top of the world, lots of energy, doing things that they usually don't do. Anything
I'm pretty much a static rock bottom.
all the time. So have you ever had any psychiatric or emotional mental problems in the past that you can think of?
No. Never.
Nothing that was. I've been quite pretty straight that way.
I used to worry a bit more than usual, but that's fine. When you are in a fragile sector, when you are taking risk and you are investing people's money, so it's good being anxious and cautious.
Yeah.
But nothing that warranted a visit to a psychiatrist.
That's thanks for clarifying that question. I just wanted to make another point bit clear about the family. Like I understand you are the eldest one in the family. So how many brothers and sisters you have got, sir?
I have 2 brothers and a sister. Yeah.
Anyone in the family having any history of emotional mental problems? Mom, dad side?
Well, my father, he suffers from depression, but he
Does
has
he?
his own reasons. He's 81 years old and he has multiple medical problems, and because of the physical things, he had bad arthritis. Recently, he broke his joint. So, so that is. But but all his life he had been a very active person.
Yeah.
And there is no one in my family that I can pinpoint that he or she has any problem with their nerves.
Talking about dad's illness, about yourself, do you have any major medical problems that you know?
No. I mean, just I had a little bit of high cholesterol, but I tried to correct it with the diet
I see.
and some physical activity. But last couple of months, I have kind of literally abandoned everything.
Yeah. So,
I have not checked it recently, but I don't.
are you allergic to any medicines or any drugs?
No, nothing that I'm aware of.
So, a few questions about your childhood. I understand you can't remember everything. but as you might have been told, do you remember any problem when you were born?
No. Uh, Nothing except like I was an atopic child. I had childhood asthma.
I see.
That disappeared when I stepped into my teens. And apart from it, no, otherwise I had a very happy, pleasant childhood.
Yeah, that's good that you mentioned that. I was going to clarify that. And your qualification, you're a banker, so you have.
Yes, exactly. Like this, I have done masters in business administration, finance, and I have done few banking exams as well. So I literally enjoyed my student life. My life had been fantastic up until now.
But people can understand that. Tell me, Sohaib, this issue. So good that you came here, although you are not very sure, very comfortable coming to a doctor, but your family doctor wanted to come here. So what you expect from me? Like, how is that something that I can do immediately to help you?
I don't know whether you'll be able to help me or not, but I would like to know whether do you have something or would you suggest anything that might help me. I know as far as the finance and the professional side is concerned, I'm not expecting anything, from the medical sector. But apart from it, like, if you have any suggestions or any advice from me.
Yeah. Maybe a few more questions to clarify this thing before I give my opinion. You have been otherwise an active man, although mostly the banking sector. About the physical side, like the physical exercises, do you do much of physical activities, or you are not a physical person that way?
No, I had never been a very physical person. At least, never been would be like, not that much. But yes, over the last like 15, 20 years, no, I have kind of been a lazy bum. And part of it was because, again, sometimes I work long hours in a very pressured job because in the bank I'm into the investment side. So it's quite a heavy job. Yeah. So the rest of the time I used to spend with my family, enjoy time with the family. But yes, if you ask me that I used to go to a gym on regular basis, no. Just yes, but I used to go for walks at least 3 times a week. 3 times a week.
But not lately, as you
Not
say.
lately, no.
Yeah, I understand.
I know the weather is good, and everyone asks me to just go out and so, but then go out for what?
Yeah. All right. So I think, thank you. You gave me a good picture about yourself. I must tell you're a good historian. So this is what I understand. Tell me if I'm wrong. Looks like you are having this low mood, and there are multiple physical as well as psychological symptoms, which are in the context of loss in the job and financial issues. Understand that. So from my perspective, it looks like that you are suffering from a condition called major depressive disorder. I'll be having a good discussion with your GP, your family physician, to get a bit more clearer picture about yourself, your physical health, and then I'll be discussing about a good treatment plan with him. So do you have any questions before we wind up the interview today?
Well, I know you are into public dealing as well, and I'm pretty sure you have seen a lot of people like myself.
Yeah.
What do you think about my odds of getting better?
Yeah. I'm glad that you asked this question. Not many people ask about these things. Let me put it this way. Depression is a special type of feeling low. It's not normal feeling low. Many of us feel low from time to time. But it's a condition in which you feel so low that at times you feel as if it's not worth being alive. And there are multiple problems in both psychological as well as physical symptoms, as I discussed. Having said that, it's one of the very common conditions in society. And I must tell you, the good news is that it is highly treatable condition. And the treatment is not necessarily medicines. It's a combination of medications along with some psychological treatment, like talking treatment, which I didn't ask little about it. Have you seen any psychologist, anyone before?
No, I have heard about this, and I have read about some of the things.
Yeah. So we will be discussing about that in a bit more detail the next session, and with your family physician as well. So a combination of psychological treatment, as I told you, and the medicines which I'm thinking of prescribing at this level of intensity of illness, as well as from your family side. Maybe whenever you feel like you can bring your wife and you can have a chat. And it's very important to keep yourself physically occupied with things and socially mixing with other people. When all those three things are being put together, biological, medical things, physical activities, as well as psychological, as well as social aspects, then the treatment prognosis is much better. So that's the thing. So once again, thank you for coming here. I'll be writing a letter to your family physician. Okay. So thanks so much.
Thank you so much for your time.